cornerstone of effective care in behavioral health settings. Cultural competency refers to the ability of healthcare providers and organizations to deliver services that meet the social, cultural, and linguistic needs of their patients. In the realm of behavioral health, where understanding the nuances of human behavior and mental health is critical, cultural competency is not merely an add-on, but an essential skill set. This discussion explores the importance of cultural competency for staff in behavioral health, examining its impact on patient outcomes, provider-patient relationships, organizational effectiveness, and broader societal implications. Let's define cultural competency in behavioral health. Cultural competency in behavioral health encompasses awareness, knowledge, and skills that enable practitioners to effectively engage with individuals from diverse backgrounds. It involves understanding cultural norms, values, and practices that influence a person's mental health experiences, communication preferences, and treatment expectations. This competency also includes recognizing systemic biases and addressing health disparities that disproportionately affect marginalized populations. Cultural competency extends beyond superficial awareness of cultural traits. It requires deep engagement with the sociocultural factors influencing mental health. For instance, understanding how stigma around mental illness manifests differently across cultures can guide providers in creating supportive, non-judgmental environments for their patients. How do we enhance patient outcomes through cultural competency? We can do this by addressing health disparities. Behavioral health disparities remain a significant challenge in the United States and globally. Marginalized communities, including racial and ethnic minorities, LGBTQ+ individuals, and immigrants, often experience higher rates of mental health disorders while facing barriers to accessing quality care. These barriers include language differences, distrust of healthcare systems, and financial constraints. Culturally competent staff are better equipped to identify and address these barriers. For example, offering services in multiple languages or employing interpreters ensures that language is not an impediment to care. Recognizing the impact of systemic racism and other forms of oppression on mental health allows providers to contextualize their patients' experiences and offer more empathetic care. We can do this by increasing engagement and retention. Cultural competency fosters trust between providers and patients, a critical factor in engagement and treatment retention. Behavioral health treatment often requires long-term commitment, making trust an essential component of successful outcomes. Patients are more likely to feel understood and respected when their cultural identities and values are acknowledged, leading to higher rates of compliance with treatment plans and follow-up appointments. We can do this by tailoring interventions. Standardized approaches to treatment often fall short in addressing the unique needs of diverse populations. Cultural competency enables providers to tailor interventions to align with patients' cultural values and beliefs. For instance, incorporating spiritual or community-based support systems into treatment plans can enhance their relevance and effectiveness for certain cultural groups. How does cultural competency strengthen provider-patient relationships? 1. By building rapport. Effective therapeutic relationships are built on trust, empathy, and understanding. Cultural competency enhances a provider's ability to connect with patients by demonstrating respect for their cultural backgrounds. Simple gestures, such as using culturally appropriate greetings or acknowledging significant cultural practices, can set a positive tone for interactions. 2. By reducing miscommunication. Miscommunication can undermine the therapeutic process and even exacerbate mental health issues. Cultural differences in nonverbal communication, expressions of distress, and help-seeking behaviors can lead to misunderstandings if providers are not attuned to these nuances. For example, a patient from a culture that discourages direct eye contact may be mistakenly perceived as disinterested or evasive by a provider unfamiliar with this norm. Training in cultural competency helps staff recognize and adapt to such differences, ensuring clearer communication and reducing the risk of misinterpretation. 3. By promoting empowerment. Culturally competent care prioritizes patient empowerment by involving individuals in decision-making processes and respecting their autonomy. Recognizing cultural values around family, community, and individual roles enables providers to collaboratively develop treatment plans that resonate with patients' lived experiences. What are the organizational benefits of cultural competency? 1. Enhancing workforce diversity and inclusion. Organizations that prioritize cultural competency often attract and retain a diverse workforce, which in turn enriches the quality of care provided. A diverse team brings varied perspectives, fostering innovation and improving problem solving in complex behavioral health scenarios. 2. Reducing liability and enhancing compliance. Failure to provide culturally competent care can result in legal and ethical repercussions for healthcare organizations. For example, Title Roman VI of the Civil Rights Act of 1964 mandates that federally funded programs provide services without discrimination based on race, color, or national origin. Noncompliance can lead to legal liabilities and reputational damage. Culturally competent organizations are better positioned to meet regulatory requirements and provide equitable care. This not only protects the organization, but also enhances its credibility and trustworthiness within the community. 3. Improving patient satisfaction. Patient satisfaction is a key metric for evaluating healthcare quality. Cultural competency directly impacts satisfaction levels by ensuring that services are respectful, relevant, and responsive to patients' needs. Positive patient experiences contribute to stronger community relationships and improved organizational reputation. What are the challenges and barriers to achieving cultural competency? 1. Resistance to change. Implementing cultural competency initiatives often encounters resistance from staff and leadership who may view such efforts as unnecessary or resource intensive. Overcoming this resistance requires demonstrating the tangible benefits of cultural competency through data, case studies, and patient testimonials. 2. Resource constraints. Developing and sustaining cultural competency programs requires significant investment in training, recruitment, and infrastructure. Organizations with limited budgets may struggle to allocate resources for these initiatives. However, the long-term benefits, including improved patient outcomes and reduced disparities, justify these investments. 3. Complexity of cultural dynamics. Culture is not static or monolithic. Within any cultural group, there is significant diversity in beliefs, practices, and preferences. Providers must navigate this complexity without resorting to stereotypes or assumptions. Continuous education and self-reflection are essential for maintaining cultural competency in the face of evolving societal dynamics. What are the strategies for enhancing cultural competency? 1. Education and training. Comprehensive training programs are the foundation of cultural competency. These programs should cover topics such as cultural awareness and sensitivity, communication skills, bias recognition and mitigation, community engagement. Training should be ongoing, with opportunities for staff to reflect on their biases and learn from real-world scenarios. 2. Community partnerships. Building partnerships with community organizations enhances cultural competency by providing insights into the specific needs and preferences of diverse populations. Collaborations with faith-based organizations, cultural groups, and advocacy networks can inform service delivery and foster trust within the community. 3. Policy development. Organizations should embed cultural competency into their policies and procedures. This includes developing guidelines for language access services, incorporating cultural considerations into care planning, and establishing accountability mechanisms to ensure compliance. 4. Recruitment and retention. Actively recruiting staff from diverse backgrounds and providing mentorship opportunities fosters an inclusive workplace culture. Representation within the workforce enhances the organization's ability to connect with diverse patient populations and ensures a broader range of perspectives in decision making. 5. Patient feedback. Regularly soliciting feedback from patients about their experiences with cultural competency can identify areas for improvement and validate the organization's efforts. Feedback mechanisms should be accessible, confidential, and designed to capture diverse perspectives. What are the broader implications of cultural competency? Advancing health equity. Cultural competency is a critical tool for advancing health equity by addressing systemic barriers that perpetuate disparities. By prioritizing equitable care, behavioral health organizations contribute to broader societal efforts to achieve social justice and inclusion. 2. Fostering social cohesion. Behavioral health services often intersect with other aspects of community well-being, including education, employment, and housing. Culturally competent care can strengthen social cohesion by fostering mutual respect and understanding across diverse groups. 3. Shaping public policy. Advocacy for cultural competency at the policy level ensures that its principles are integrated into broader healthcare reforms. Policymakers play a vital role in funding cultural competency initiatives, establishing standards, and monitoring compliance to create systemic change.
When I think of the term cultural competency, I think of being aware of not only my culture, but having awareness of other cultures as well.
Cultural competency to me is about acknowledging and honoring differences, not only in a coworker or a patient's culture, but more importantly, in one's own culture.
To me, cultural competency means to have the ability to recognize and be aware of people's differences, and in spite of those differences, be accepting and respectful to all.
I'm working in an environment where I can respect the beliefs, traditions, and customs of others.
I believe that cultural competence is actually a critical ingredient of what we term person-centered care. Asking questions regarding the person's cultural experiences, needs, and their preferences, understanding the pervasive impact of shame and stigma in seeking mental health services, and helping in a way that's comfortable and acceptable to the individual and his or her family.
Being culturally competent is acknowledging and understanding that people may be different but should be treated with equality and respect. Culture is who we are. We should embrace it with pride and dignity. Soy colombiana y soy Rutgers UBHC.
Moi c'est haïtien, moi c'est Rutgers UBAC.
Ana Masreya wa Ana Rutgers UBHC.
I am African American, and I am Rutgers UBHC.
Yo soy Latina, yo soy Rutgers RBHS.
I'm of Eastern European descent, and I am Rutgers UBHC.
Soy colombiana y yo soy Rutgers UBHC.
Yo soy hispano y yo soy Rutgers UBHC.
I am an African American, and I am Rutgers UBHC.
In conclusion, cultural competency is indispensable for staff in behavioral health, serving as a bridge between diverse patient populations and effective care. By addressing health disparities, fostering trust, and enhancing communication, cultural competency improves patient outcomes and strengthens provider-patient relationships. At the organizational level, it promotes inclusivity, compliance, and patient satisfaction while contributing to societal goals of equity and cohesion. However, achieving cultural competency requires intentional efforts, including education, community engagement, and policy development. Behavioral health organizations must prioritize these efforts to meet the needs of an increasingly diverse society and uphold their commitment to equitable, compassionate care. As the field of behavioral health continues to evolve, cultural competency will remain a foundational element of quality care, shaping the future of mental health services for generations to come.